Taping for knee osteoarthritis. Begin the procedure by measuring the length of the tape to be used from the top part of your thigh to the tibia just below the knee joint. Cut your tape according to that measurement. Remember, we are going to use 3 of them, so cut additional 2 strips with the same length like the first strip. When you are done, put all the strips together and shape the edges to look more nicer. Now, with the knee extended, tear the middle of one of the strips. Stretch fully and apply the stretch parts just below the kneecap. Remove the paper from the 2 ends and apply them firmly with no tension in partial knee flexion position. Now begin to press down the tape to stick to the area. Begin to prepare the other 2 for the application. By tearing the end of the tape, apply to the thigh just above the kneecap with no tension. Stretch the strip and begin to apply around the knee joint, covering the lateral epicondyle and overlaps on the first one already in place. Begin to apply the last one, starting from the upper thigh. Apply some stretch and then start applying, covering the medial epicondyle to the tibia.